Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And I'm Bailey Merzick, also with the Department of Communication. Today, we're going to talk about an important initiative that is designed to limit the effects that sepsis has on patients in our health system.
Now, before we get into that, make it your initiative to go back and get caught up on any episode of The Wrap you may have missed. You can find the shows on iTunes, Stitcher, Google Play, or any other podcast hosting platform. New episodes debut weekly, can also be found on the Michigan Medicine YouTube channel and as part of the Headlines Week in Review.
All right, let's dive right into our discussion on sepsis, as September is Sepsis Awareness Month. Today, we're joined by Dr. Jesse King and Tammy Garcia, two members of the team raising awareness and improving treatment of sepsis at Michigan Medicine. Dr. King and Tammy, thanks for joining us today.
Thank you for having us.
Now, first, what is sepsis and how does it end up affecting somebody?
So sepsis is the body's exaggerated response to infection. Exaggerated in such a way that it ends up causing harm rather than actually helping fight the infection. I think of it as, the things that occur locally. So for example, if you cut your finger, it gets red, it gets hot. What's going on locally is all your blood vessels are dilating and allowing the white blood cells to come in and fight that infection. So sepsis and septic shock are that occurring in the entire body. So the entire body has dilated blood vessels. Those blood vessels get leaky and patients' blood pressures drop, and they really don't do well when the body exaggerates their response to the infection.
At Michigan Medicine, what does your day-to-day sepsis work look like?
Well, at Michigan Medicine, we started, our sepsis team in mid-March is when our team fully formed. There are four of us. We have myself, who's the lead, and I'm over the three coordinators and one in children's and women's, which is Sarah Pulley. We have a coordinator, Carly Redstone. She's in our adult emergency service. And then we have Rosalie Mulcahy, and she's in our inpatient area. We've done a lot of work of looking at what the past work was. They have done a tremendous amount of work over the last 5-6 years surrounding sepsis. They've initiated pathways, put things in Epic to alert patients and screen patients. They build this tremendous amount of dashboards and databases that we've been trying to understand, what the data says and how we can use that data to help support our teams and looking at what interventions we need to do better as a team. So we went about creating the day in the life of a coordinator, so to speak. So really we are doing a lot of creating a patient list so that we can look at those patients that are at risk for sepsis or are screening positive for sepsis. And then we're building that into our day to go round on those patients, whether it's physically rounding on the units and checking in with teams, or we do a lot of secure chat with messaging with our teams as well. We know they're busy and sometimes we can be in the way, especially in the emergency room. So we are doing a lot of like that hands-on at the hip feedback and working with them to make sure that they, one, have we identified the correct patients for sepsis? And two, are we looking at the bundle and where we're at and getting those early interventions in place, because we know the sooner we have those interventions in place, the better our patients are going to do. So along with that, we're also running meetings. We have an inpatient meeting, we have a PEDS meeting, we have a maternal sepsis meeting, we have an AES sustainment meeting, we are working on our transition of care. So we're working on those meetings because those are the workforce. Those are the people that we are bringing together, looking at all the work that we need to do, and then working on what interventions we can do to improve our outcomes. And then we're also, like I said, looking at data. We're creating and providing education for our frontline staff at our provider levels and at the nursing levels. And then we're just working on creating documentation and education flyers for our patients as well and staff.
So it's clear that the team is going to be beneficial for sepsis awareness, but I want to talk a little bit about the data that you mentioned. Has the team been formed long enough that you've been able to look at the data and seen sepsis trending in a good direction at Michigan Medicine since the formation of the group?
So the short answer is yes. Our sepsis team is already making a difference. I think the area where it is the most obvious is in our management of sepsis in the emergency room. When a patient presents with sepsis, there are several steps that we anticipate should be taken in order to treat that patient properly. And we've seen over time that sepsis bundle, so those treatment elements, are being completed with more reliability.
And why is Sepsis Awareness Month so important? Why is this a topic that we need to always talk about?
Well, sepsis is the leading cause of death at Michigan Medicine in our adult hospitals, and it affects about 150 patients per month in our children's area. So it is of high priority for us to reach these patients and treat them and increase their outcomes. So we're using Sepsis Awareness Month as a time to, as I said, we've had 5 years of work and more going with sepsis, but this is just a time for us to build that awareness, bring, re-engage staff. We're hoping to, get our team out there more, that we're here to help. We know a lot of work is done. We're not here to take over that work. We're here to help enhance that work and help provide support and knowledge and education to teams.
So let's provide some of that education. I know some of our listeners, are working with patients on the floors. What are some of the key indicators providers should look out for if they suspect a patient has sepsis?
Are you asking how a patient who's septic presents?
Yeah. Yep. What are some of those key indicators?
Yeah, so this is actually where the biggest challenge in sepsis lays, because unlike a stroke where symptoms are pretty obvious or hopefully pretty obvious, or a heart attack where the classic chest pain occurs, sepsis presents in many different ways. Some patients have fevers. Some patients drop their core temperature, right? So hypothermia rather than having a fever and being hyperthermic. Some patients are, read our textbooks and present with, what we call tachycardia, so high heart rates, and they drop their blood pressures. Some patients are a little bit more, what's the word I'm looking for, subversive in their presentation. Not subversive, but they can present with confusion. They can present with a new oxygen requirement. And unfortunately most patients don't present the way that our textbook says they're going to, and they can present any way they want to. And unlike a heart attack or stroke, where we have really good tests that can confirm the diagnosis, with sepsis, there's no single test. And so you have to have a pretty high suspicion that your patient is septic in order to catch it early.
And to go off that, who is most at risk for developing sepsis?
So everybody is at risk for sepsis. This can happen to anyone. There are certainly patient populations that are at higher risk for developing sepsis or higher risk of mortality from sepsis. So people at extremes of age, so young children or our elderly population, patients with impaired immune systems. So either there's something wrong with their immune system innately, or we're giving them medications to suppress their immune system to treat another disease. And so without a strong immune system, you may not react to the infection until it's, or you may have a delayed reaction and not react until it's quite severe. Also think about patients with, indwelling lines, Foley's hardware, right? So things that normally our bodies don't have, bacteria like to grow on. So there are a number of risk factors, some of which we can control, some of which we can't, that makes patients more at risk for having a poor outcome. But the honest answer is anybody within the right clinical setting can develop severe sepsis and septic shock.
Now, outside of watching the wrap in this episode, what are some other ways staff can educate themselves on sepsis?
Working really hard as a team to look at the education that we do have available at Michigan Medicine and making sure that it's up to date and available to staff. So we have, in our nursing clinical homepage, we have an A to Z policies that has a sepsis link that we're working on updating the materials that are there. We are doing some, like I said, we're doing that hands-on at the bedside education too. We're providing this information to our team so they can be talking them at their UBC meetings, putting information at their DMS huddle boards. And then also, we have the internet, right? We have Sepsis Alliance is a great place for people to go. And also we have the Surviving Sepsis Campaign website that offers webinars and a ton of flyers and information. And then we're also working on that patient education that we want to give to for staff so that we can be letting staff and patients' families know when they go home. We know when patients are discharged with sepsis that they have a higher risk of being readmitted and having sepsis again.
And Tammy, I know you've been working on some stuff. What are some things that we're going to have going on around the organization throughout the month of September?
So yeah, we've been been working hard, as you know. We working on a headline story, this podcast. Like I said, we are really looking at our education and updating that and getting new, I don't want to say new and improved, maybe just making it re-energized for staff, something else that we've seen these our Stop Sepsis and Spot Sepsis, and we're just trying to re-energize that, get the information out that way. We're going to do some meet and greets on the 13th, which is Sepsis World Sepsis Day. So the coordinators and I will be out with carts, and we have some swag we're working on getting to staff, and then some literature that we're going to be hanging out, and then just making ourselves visible on the units. We really want to make rounding a priority so that they can see us, ask questions of us, and know what we're there for and how we can help support them. And then there's also going to be DMS or safety huddle messages all month long for every week. And then there's going to be some quizzes at our quiz at the month where staff can win prizes. So we're just hoping to engage staff and teach them and let them learn at the same time, also giving them a little incentive to listen to what we have to say and then know the importance of sepsis and how we can treat it.
Yeah, I think that's a great idea. And I really appreciate the two of you coming on here, sharing your knowledge about sepsis and helping everyone spot it and stop it at Michigan Medicine. Now, if you want to learn more about sepsis, you can go to mmheadlines.org. That's mmheadlines.org.
Okay, it's time for the lightning round. When we asked one of our guests 4 quick fire questions, Dr. King, you lost in a game of musical chairs earlier today. So you are in the hot seat. Are you ready to go?
Sure.
All right. With Labor Day just around the corner, that means fall is on its way. What is your favorite fall activity in Michigan?
Oh, that's easy. So with my kids, we like to go apple picking, right? Who doesn't? But here's my other secret passion is actually horseback riding, and nothing is better than a trail ride through the woods with the leaves changing.
And September is also Classical Music Month. Are you into classical music? And if not, what is your favorite type of music?
So I listen to classical music. I wouldn't say I'm passionate about it. Usually, if I'm Christmas time, I run the Baroque station on my Alexa.
That's great. If you had to eat one meal every day for the rest of your life, what would it be?
Oh, that's hard. Anything with carbs, right?
Sounds like a doctor's answer right there. Yeah.
Right. Yeah, that's a hard one. Wood-fired pizza. There we go.
Good answer. All right, looking back on it, what is one piece of advice you would give your younger self?
These are hard questions. These are not rapid fire. I have to think about these. I would have to say it's worth it in the end to keep going, because it's a long haul to get through medical school, and I had kids while I was still in school, and so yeah, it's in the end it'll be okay.
Thank you so much, Jesse, for letting us get to know you a little bit better. If you want to learn more about sepsis and how you can help improve patient outcomes in Michigan medicine, go to mmheadlines.org.
And while you're there, you can check out other featured stories from this past week. For instance, there was a closer look at UMaze, a program that offered adaptive and inclusive sports experiences all summer long, and readers learned about the organization's flu vaccination policy, with the first clinics beginning this week. Find all that and more at mmheadlines.org.
All right, Bailey. Now, you mentioned the UMaze story that ran in headlines earlier this week. And as some of our listeners may know, I use a manual wheelchair. So I actually was able to take advantage of some of those programs this summer. I went kayaking, hand cycling, and of course, I helped lead some of their wheelchair basketball as I coach the pediatric wheelchair basketball team here, the Wolverines. So I want to know, are there any sports you play or stay active with regularly?
Yeah, I mean, I've been a basketball player my entire life throughout high school. I ran cross country and track in high school and college, so I'm still a very avid runner. I use it as just a outlet for stress, and it's great. I get up and go for a run pretty much every morning. So yeah, that's probably what I do the most to stay active.
Nice. Now I struggle with that, like going for I guess it's a wheel, but I have a hard time with that. But like I really admire the people who do go for runs, because I feel like it's a great way to stay physically healthy and mentally healthy, right? You use it as sort of a way to recharge. So I'm very impressed with that. All right, it's time for the weekly trivia contest. This week's question is, the Rogel Cancer Center recently submitted a grant renewal for which type of support grant? Once again, the Rogel Cancer Center recently submitted grant renewal for which type of support grant? Or you can find that answer in this week's headline story. Once you know it, you can send it to headlines@med.umich.edu for the chance to win a prize.
And that's all the time we have for this week. Thanks again to Dr. King and Tammy for joining us. And thanks, as always, to all of our listeners and viewers for everything you do for patients, families, and each other.
We'll see you next week.